Hi, welcome to today's session on being a part of the catheter insertion team. This training is part of the Agency for Healthcare Research and Quality Safety Program for long-term care that addresses healthcare-associated infections and catheter-associated urinary tract infections. My name's Bonnie Lansing, and I'm a research nurse and project coordinator with the University of Michigan. I'm also a member of the Long-Term Care Program's National Project Team. And prior to my position at U of M, I worked as a charge nurse in long-term and subacute care for many years. Because of that experience, I know how hard you work and the challenges of your job. So thank you for being here. Upon completing this webinar, licensed staff who insert or assist in the insertion of catheters will be able to explain the differences between 4 types of catheters, prepare for and insert a catheter using aseptic technique, and summarize some effective strategies in preventing catheter-associated urinary tract infections. This session will help you understand how you, regardless of your role, can make a difference in the safety and quality of care for the residents that we serve. So let's get started. You're all familiar with urinary catheters. An indwelling, often referred to as a Foley catheter, is a drainage tube that is inserted into the bladder through the urethra in order to drain urine from the bladder. It's connected by tubing to a bag used to collect and measure urine and is a closed system, usually kept in place for a period of time. Take note of some of the ways and times catheters can act as a portal of entry. Microbes that may cause infection can travel both inside and outside catheter tubing. For instance, capillary action is simply the movement of a liquid through or along a surface of another material in spite of another force, such as gravity. That's why the way you insert and care for catheters is so important. In addition to an indwelling catheter, here are some alternatives to consider. These are good to keep in mind during resident assessments. Straight catheters are one-time use catheters and used for a number of reasons intermittently. A resident may not be completely emptying their bladder when voiding, or perhaps not able to void at all. Suprapubic catheters are surgically placed through the skin into the bladder and also connect to a collection bag by tubing. And finally, external condom catheters attach over the penis using an adhesive. And because they're used for residents who can void, they are not appropriate for treating urinary retention. It is important that nurses look for an indication of continued use of an indwelling catheter and that regular periodic assessments are done. Share the assessments and your thoughts with the physician. A resident's condition can certainly change, and at some point, another option may be more appropriate. Maybe an external or straight catheter can be used, or a toileting program would now be beneficial for that resident. If you get an order to place a new catheter, review it and verify that it's clinically indicated. And remember to get your supplies together and find someone to assist you before you start. As you know, most kits, if not all, contain these contents: a drape with an opening, a pair of sterile gloves, antiseptic solution, swabs and tongs to use for applying the solution, a single-use package of lubricant, and a single-use dose of topical lidocaine jelly, a sterile urinary catheter, collection bag and tubing, and a catheter securing device. These are the things that you're going to need, so be sure to have them all before you begin. In preparation, have your resident in the supine position. Get someone to help you at the bedside, making sure that he or she has washed their hands and put on their personal protective equipment. By using a gown during the preparation and the procedure, you can avoid contaminating your clothing due to any splashing that may occur, and also minimize the risk of transmitting any multi-drug resistant organisms that might be present. For female residents, apply topical lidocaine for comfort. For a male resident who is uncircumcised, retract the foreskin. Inject 10 to 15 milliliters of topical lidocaine into the urethral meatus and gently pinch the tip of the penis for several minutes to retain the lidocaine. Inspect your catheter kit and remove it from its outer packaging. Open the inner paper wrapping to form a sterile field on a bedside table or another flat surface. Don't use the resident's bed. Then remove your gloves and cleanse your hands. To help prevent catheter-associated urinary tract infections and the spread of organisms to residents with urinary catheters, be sure to clean your hands again, and you can now put on a gown. Put on your sterile gloves and remove the absorbent pad, placing it under the resident's buttocks with the plastic side down. Cover the resident's lower abdomen and upper thighs with the opening placed to expose the urethra. Then organize the contents of the tray on the sterile field. Keep in mind, you'll need these things within easy reach. Pour the antiseptic solution over the swabs in the tray and squeeze the sterile lubricant onto the tray. The key here is preparation. The more you have prepared and ready to use, the less likely you are to make a mistake. And it's more likely that the procedure will go quickly, smoothly, and that you'll keep things aseptic. Insertion. Using your non-dominant hand, hold the penis taut and perpendicular to the plane of the resident's body. Be sure to keep your non-dominant hand in this position. Don't switch hands, because it would now be considered unsterile. With your dominant hand, use the tongs to pick up the antiseptic-soaked swabs, and in an expanding circular motion, cleanse the glands of the penis. Be sure to discard the swabs away from your sterile field. Lubricate the tip of the catheter with the jelly, and again, using your sterile dominant hand, gently insert the catheter tip into the urethral meatus. Then advance the tube slowly into the bladder. Don't force the catheter if you meet with substantial resistance. And if you do accidentally contaminate the catheter tip by touching anything that is not sterile, discard the catheter and get a new one. For a female, you're going to use your gloved, non-dominant hand to spread the labia and identify the urethra. Slightly spread the inner labia, gently pulling upwards. Don't remove that hand. Using your dominant hand and the tongs, cleanse the area in the opening using the prepared swabs and discard them away from your sterile field. Lubricate the tip of the catheter and holding it in your dominant hand, gently introduce it into the urethral meatus. Slowly advance the catheter through the urethra and into the bladder. Again, if you meet substantial resistance, don't force the catheter, as you can cause trauma or injury. If the catheter becomes contaminated by touching anything not sterile, discard it and get a new one. If you should accidentally begin to insert it into the vagina, do the same. With proper insertion, you should see urine in the tubing, and only then should you advance the catheter another 3 to 5 centimeters and inflate the balloon with 10 cc's of sterile water. Tug gently on the catheter to make sure it's secure. Then secure the tubing to a medial thigh and place the drainage bag below the level of the bladder. Roll up the contents of your catheter kit and wrappings and discard them. Finally, remove your personal protective equipment and immediately wash your hands. Now that we've reviewed how to properly insert an indwelling catheter using aseptic technique, let's go over some things to avoid common mistakes. Clean your hands before and after prepping and before and after the procedure. put on your sterile gloves after opening and preparing the catheter kit. Catheters become contaminated by touching the labia, insertion into the vagina, or by touching any other part of the body other than the cleansed opening. If this should happen, stop and get a new sterile catheter. Use the tongs to cleanse the urethral area with your sterile hand and do not switch hands. Remember what I mentioned earlier, that the key to proper aseptic insertion is to prepare as much as possible. As we wrap up today's discussion, I'd like to thank you for your time and attention to this program and for working to make your long-term care facility a safer place for residents, for their families, and staff. The following resources are available to you as participants in this program, and we hope that they'll be useful as you help your facility improve its culture of safety. The first resource is a link to the AHRQ Safety Program for Long-Term Care project website. On the website, you'll find a variety of tools to help you prevent CAUTIs and improve your facility's culture of safety. The second resource is a link to the Team Steps for Long-Term Care webpage. Team Steps is a communication and teamwork system that offers solutions to improving collaboration and communication within healthcare facilities. The resources on this page are specifically designed for the long-term care environment. The third resource is a great link for more information with a section on educating patients and families regarding indwelling catheter care and use. Thanks again, everyone, and have a great rest of your